Hello everyone, this is Dr. Yasar Basaga. I'm consultant andrologist in Istanbul. Today I would like to talk about surgical treatment of premature ejaculation. As you all know, if you follow us, and you can see that we presented our results in SMSNA Congress in Dallas, USA, related with the surgical technique. Selective dorsal neurectomy surgery is very popular, especially in Eastern countries, and there are some concerns from Europe and USA for the surgical technique and surgical treatment because of the lack of data about the safety of the surgical technique. We perform neurectomy just like for last 3 years, around 1,000 of cases we completed with the neurectomy surgery, and I am securely can say that neurectomy surgery is a safe technique. There are some tips and tricks to get a great result after neurectomy surgery, and the expertise is the most important key point for the surgical treatment. Because selective dorsal neurectomy, there are some tips and tricks and important points in surgical technique. Because in selective dorsal neurectomy, in the beginning, there was techniques that are cutting all of the nerves. Now we are trying to select the nerves to preserve a good sensation and a good erection. If you cut all of nerves, you can lose the sensation and you can lose your erection. But in our technique, we select some of nerves. We do 360 mapping of nerves, dorsal nerves of the penis, and we select the nerves that we are going to preserve first, and then we go further with the surgery. We go further with the nerves that we are going to resect. And we know that if a good selection is done with the surgical technique, you will not lose your sensation, you will not have loss of sensation, and you will not have erectile dysfunction after surgery, because the erectile nerves and the sensory nerves are completely different from each other. The only scenario that the patient can have erectile dysfunction after neurectomy surgery is a total resection. If you resect all of nerves, you will have loss of sensation and you will have erectile dysfunction. In a good technique, expertized clinic, you will not have any loss of sensation of any erectile dysfunction. For the patients who have hypersensitivity, who has benefit from creams or sprays, and who is tired of using creams or sprays and looking for a permanent solution, neurectomy surgery is a good option. You have to have a primary premature ejaculation, which means you have to have a lifelong premature ejaculation. And if you are tired of getting other treatments, or if you are not getting benefit from other treatments, you have to consider to get neurectomy surgery. The surgical technique is a safe technique, is a fast technique. It can be done under local anesthesia, and you can go back to your social life immediately. After 3 weeks of surgery, you can go back to your sexual life immediately and very healthily and powerfully, and you will have a great result after surgical technique. The success rate over 90%, and the latency times generally is over 5 minutes of sexual intercourse. If you have big problem issue with the latency time in vagina, if you are very bored of getting other treatments, and if you are shame and shy about the premature ejaculation, please contact my team and learn much more about treatment options.